thank the pastorate led by Pastor Bolade Okenla for this opportunity to be here today to make this presentation to the church. We are very grateful for this opportunity. And today we'll be talking to us about personal hygiene, healthy living, and medical checkups, and how this is very important for prevention of both communicable and non-communicable diseases in our lives. And this topic is very important in the sense that this is a business summit, and they say that a healthy man is a wealthy man. So the Bible says, what does it profit a man if you get the whole world and you lose your soul? So exactly the same way, what does it profit you if you have all the money in the world, all the investments in the world, and your health is lacking? Of course, you will not enjoy that wealth. You will not enjoy it. Imagine that you're very wealthy, you have an investment here and there, but you're always in the hospital 2 times a week, 3 times a week, and you're going for dialysis. Or what benefit is that? And that's why this topic is very important for this our business summit today. So, taking this topic, we've divided this topic into. Please, let's go to slide 3, please. Slide 3. The topic is divided into the personal hygiene, healthy living, and also medical checkups. And it's a 3 defense layer for how to protect ourselves from various diseases. If we look at the slide, you'd see the patient here, or we here, and you have different barriers for which you can prevent different infections. So you have barrier 1, which is how ability to protect yourself, which is the personal hygiene, which is the first barrier, what we can do for ourselves. Barrier 2 is the healthy living. What are the practices that we must inculcate within ourselves daily? And barrier 3 is now when you have to go and do checkups. And this is very important because for every condition, there are what we call modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors now are factors that are already there because of the kind of person we are, the gene we carry, that we cannot do anything about. So for instance, if you're a man, you're already predisposed to having to develop some conditions. As you age, you're already prone to develop some conditions. And then the same thing if you're a woman, aging, and so all those factors are classified as non-modifiable. There's nothing you can do about it. But the one we can do something about, which is the modifiable factors. You now have conditions like what we eat, our diet, exercise, and a daily lifestyle. So the first one, which is personal hygiene. How do those personal hygiene prevent us from developing various conditions? So how often do we wash our hands? How does hand washing, drinking water, and keeping our environment clean, how does it protect us? So we go to our Act 1, which is to protect. Which is, it says that the daily defense against external threats. So personal and environmental hygiene are the essential first steps in preventing infection and protecting both individuals and communities. So the first step on protecting ourselves is our personal hygiene. Washing of hands, making sure that your environments are clean, and this will help to prevent diseases like cholera, diarrhea disease, dysentery, malaria. Of course, if there are bushes around your house, you can get infected with malaria from that through mosquito bites. If there are stagnant waters around our household. So what is the anatomy of daily hygiene? The next slide, please. So the first one we have is what I talked about. That is hand washing. Very, very important. As simple as this may be, because I'm sure this topic is something we have heard over and over again, but they are very, very, very important. Even our children, some of them, they're already teaching them some of these things, but they are very important. So hand washing, very important. And it says, use soap and clean water for at least 20 seconds to wash your hand. How often do we get to wash our hands every day? You know, we finish service. When you finish service, you greet like 10 people after service that you are shaking hands with. And before you know, you buy something and you put it in your mouth straight away. We have to inculcate that habit of always washing our hands. Hand washing, very important. Oral hygiene also. It is recommended that we brush our teeth at least twice a day to prevent tooth decay and gum diseases. Regular bathing also, very important. Hair and nail care. Some of our women, they just put wigs on their heads and they will not have washed their hair for a very long time. By the time they remove those wigs, the kind of odor will perceive from that hair. It's very dangerous. Then nail care too, very important. If you wash your hands and your nails are not properly trimmed, you still have a lot of microbes and microorganisms that can, get stuck within your nails. And by the time you wash your hand and you eat, you still get yourself infected. So hair and nail care too, very important. Then clean clothing and food hygiene. How do we cook our food? Our food, is it undercooked or do we cook them properly? How do we, even our foods that are our raw food, how do we preserve them? We live in a country where Lassa fever is endemic and, at least twice in a year, we always have epidemic of Lassa fever. How do you cover and protect your food so that rodents don't come and perch on those foods? How do you protect your food? Then some of us, you eat the previous day, you keep your plates till the next day, and you don't wash them properly. These are things that we have to inculcate. Personal hygiene, very, very important. Next slide. So it has been explained that hand washing and clean water alone account for 70% of infectious disease prevention. Very important. We might tell ourselves that, I drink dispenser water. How often do we wash our dispenser machines? How often? We have to. It is been recommended that at least between 1 to 3 months, those dispenser machines should be washed. For those of us that use dispenser machine at home, so clean water very important. Hand washing very important in prevention of infectious disease, and also sanitation, like I spoke about. Then vaccination. Of course, all our children, when we give birth to them, we all take them for vaccination. Vaccination. There are also vaccines for us adults too, as well. Very important. So what are the benefits of personal hygiene? It's a ripple effect. Next slide. So the first effect you get from this is clean body and clean environment. Your environment is clean. You're clean. It helps you prevent infections and improve your overall health. It boosts your confidence. And more importantly, it improves your social well-being and it enhances productivity. Imagine that you're taking excuse duty every time from your work. Instead of being at work, you're in the hospital because you're always falling ill. Of course, there'll be poor productivity in your office. So, personal hygiene is very important. Then it also reduces the cost of healthcare. Hand washing, you don't know how much hand washing would save us, all of us, from the amount of money we have to spend going to, treat various illnesses in the hospital. So very, very important as well. So it's a ripple effect. The benefits of personal cleanliness extend far beyond you as an individual, creating a ripple effect that ultimately strengthens the entire economy. So the second barrier that we're talking about, we talk about personal hygiene now. The next one is our healthy living, which is, if we go back to the first, please, next slide. If we remember the first slide that we displayed, where we talked about the different barriers. So the first barrier, which is personal hygiene, helps you to protect yourself, and to strengthen your health is the healthy living itself. And there are various pillars of healthy living. And now the third barrier is the frequent medical checkups. So how do we strengthen our health, which is building the internal foundation? Moving past immediate threats, healthy living involves ongoing lifestyle choices that promote well-being and radically reduce the risk of chronic disease. So this healthy lifestyle helps us to reduce the incidence of non-communicable diseases like diabetes, like hypertension, obesity, cancers, so many of these. So this is very important. Next slide. So there are key elements of healthy living. We have from balanced diet to regular exercise, adequate sleep, stress management, tobacco smoking cessation, and also to limit alcohol. The other speaker will talk extensively about substance abuse. The next slide also we talk about weight control, which is also very important, and social connectedness. So the first thing we want to talk about is physical activity, that is exercise. Next slide, please. And is categorized into two, that is physical activity, which is baseline activities, that's activities of daily living, how when you want to go and get groceries on the streets, you going walking by yourself to that place, that is activities of daily living. Climbing the staircase, going to driving, these are all physical activities of daily living. While the other ones, which is what we try and emphasize, is physical exercise. Very important. It is planned, coordinated, and regular physical activity that is carried out to achieve one or more components of physical fitness. And next slide. It's been recommended that, so this slide just goes to explain the number of steps and what category you fall in if this is the number of steps you take in a day. A lot of us now have smartwatches that have a podometer where you can always check the number of steps you have taken a day. So this is something we can be very confident about and always check. So if you take less than 5,000 steps in a day, it means you're living a sedentary lifestyle and you're putting yourself at risk for hypertension, for obesity, for diabetes, and the likes. So if the number of steps you take is between 5,000 to 7,499, so you're active but lowly active. If it is between 7,500 to less than 10,000, somewhat active. Above 10,000 to less than 12,500, you are active. Then above 12,500 is highly active. But the recommendation is between at least 7,000 to 10,000 steps in a day to keep us active. That is the recommendation. So we must try on our own, make use of the smartwatch that you have to always assess yourself whether you're living a sedentary lifestyle or you're active in everything you're doing. So the next slide tells us about the 150-minute rule, which is important. That is, in a week, we should try and exercise at least for 150 minutes, which is at least 30 minutes, 5 days of the week. At least 30 minutes, 5 days, and of which, if you look at the slide that is, you have like 2 days rest in between. But it is important also to note that you shouldn't give yourself more than 2 days, meaning, so if you exercise on Monday and you take Tuesday off, it is very important that you go again on Wednesday. So you don't do Monday, skip Tuesday and Wednesday, then you come and exercise then you'll be defeating the aim. So 150 minutes in a week, 30 minutes every day, we must exercise. And what are the things we can do? You can do brisk walking, you can jog, you can swim, you can skip, you can have a bicycle that you can ride around your estate, wherever you stay. Very important. So the next one we want to talk about is diet. And the important thing with diet that we have to note is that whenever the amounts of calories you consume exceed what you burn as in exercise or anything, your expenditure, then you'll be gaining weight, which will be putting you at risk for a lot of these conditions. So the energy you eat from diet must be equal to what you expend. Very, very important. So when there's a mismatch, then we tend to go into being overweight, obesity, and all the likes. So so how do we go about? What are the kind of diets that we should eat? Next slide. Healthy diet is designed at a diet that is helped to lower blood pressure and cardiovascular incidences by nutritional means. It emphasizes food that are rich in calcium, potassium, magnesium, and fiber, which helps to lower your blood pressure. So examples are fruits, essentially, and vegetables. So potatoes, vegetables of all kinds, spinach. These are diets that will help us to lower our blood pressure and, also help us to balance the energy that we consume, the calories that we consume. So I used to tell my patients that when you have a plate in front of you, half of that plate should be vegetables and fruits. A quarter of it should now be your eba or your fufu or your amala. And why a quarter of it should now be your protein. And for a lot of us, especially our colleagues that are already in the wisdom group, it is emphasized that you should take more of white meat than red meat, which is fish, chicken, than shaki, goat meat, and the like. So, the take home from this is half of your plate should be vegetables, a quarter your swallow or carbohydrates, then your protein, as the case may be. So, healthy diet also is low in saturated fats. So, food like butter, cheese, bacon, cakes, those things we should try and reduce it as we eat all those things. Then that is very low in, so our salt intake must be very minimal. Then reduce intake of red meat, like I said. Then it's recommended to take an average of at least 3.5 liters per day for adults. It can be more than that. Of course, we know that this is the heat season, so we should even take more than 3.5 liters. And how do you estimate that? So the 75 cl of seaway bottle, so at least 5 in a day is what we should take. At least 5 of it is what we should take in a day. Weight control, next slide, very important. And how do we assess our weight? We've had the service before on Sunday where was a weight service where we talked really in details about this. You know, where we did our BMI, we had to go outside, weighed ourselves, took our height, if you can remember. So this is how we can, the BMI is one of the easiest way to assess your weight and how you're doing. So how do you do that? Your height, you multiply your height in 2 places. So for example, if I'm 1.7 meters, I multiply 1.7 by 1.7. Whatever I get, I will now divide my weight by that figure. So for example, 1.7 by 1.7, you can get 2.89. And if my weight is 80 kilograms, for instance, I now divide 80 by 2.89. Whatever I get will now help me to know what weight class I fall into. And so how do we classify weights? Next slide. Classification of weights is into, if you are less than 18.5 on your BMI scale, then it means you're underweight. The appropriate weight is between 18.5 and 2.49. That is the normal weight that we should all aim to. Then between 25 and 29.9 is overweight. 30 to 34.9, class 1 obesity. Class 2 is 35 to 39.9, and above 40 is class 3 obesity. So this is also very important for us. It's very easy for all of us to try and get our BMI and know what weight class we fall into and know how we can now improve on this. The next slide talks about stress. And we all face one form of stress or the other. Stressors from work and, maybe death of a loved one, you're chronically ill, or maybe we have a family member that's also seriously ill, so that can also put burden on us as caregivers. Different things, or you're driving on the road, there's a traffic jam, there's a driver that's trying to misbehave, or somebody hits your car accidentally. All these things are different stressors. So, but the thing is, if you don't react to stress in a positive way, you get to release hormones such as cortisol, epinephrine, and these hormones, which are the stress hormones, they help. One thing is that you can, because of this increase in these hormones, you can be binging of food, and it can lead to overweight, leads to anxiety, depression, and the likes. So, but what if you have a positive outlook towards stress as well? Whether it's your boss at work, it can help to cope with this stress, and you're able to cope well with this stress. So next slide. So the next slide talks about the pessimistic approach to stress or the optimistic approach. So when you are pessimistic about you already have this fear of doom because of what you are going through, it will increase your ability to develop some of these conditions, and it will reduce your ability to handle stress. But once you have optimistic outlook towards stress, it will help you to resist infection, allergies, and overall improve your general health. The next thing I want to talk about is sleep. Sleep, very important. Next slide. So sleep is a state of suspended consciousness from which a person can be aroused by appropriate stimuli. So sleep is very, very important, as much as it is. Next slide, please. So the next slide will tell us how much hours of sleep we should sleep in a day. So for adults, it said that appropriate hours to sleep is between 7 to 8 hours in a day, and we can see that it goes all the way even to newborns. So when you don't have this adequate amount of sleep, of course you pose yourself to risk of developing all these chronic illnesses. Sleep hygiene also. Let's talk about sleep hygiene, because a lot of times people will come to the hospital, they'll say, doctor, I've been trying, I've not been able to sleep. There are some things we ourselves will do to make it difficult for us to fall asleep. So when you in your room is not very quiet, it's not dark, it's not well ventilated, of course you find it difficult to sleep. Bedroom activity should be limited to sleep, and of course for couples, sex. Then TV is the modern lifestyle we live today is a lifestyle where everybody wants to have TV in their rooms, and it is not good for us. So your TV should be in your living room, and not in your room. Because, of course, when TV is in the room, you want to follow up on news, you want to watch Netflix, you want to watch Showmax, and before you know, you won't be able to have up to 7 hours of sleep, which is adequate. Then avoid caffeine and use of alcohol. If you want to sleep before bedtime, it should be light sleep, maybe an hour, 2 hours. Then avoid heavy exercise near bedside as well. So the next thing I want to talk about is substance use. Next slide. My colleague will come and dwell very well on this. And this is just refers to inappropriate use of drugs, chemicals, or substances. And of course, we're in church, so we should feel that a lot of us would not fall into this category, but that there might still be 1 or 2 people that go ahead and do all these things. And so, what are the very important things we talk about when it comes to substance use? Tobacco of any form, use of tobacco of any form, alcohol as well. Next slide. So you can meet someone and come and say, I don't smoke. But by the time you're doing these other forms of tobacco use, that's the hookah, the shisha, snuff, factory-made cigarettes, they are all the same thing. And in medical school those years, I think Dr. Theophilus has mentioned it before here, that anytime they ask us in school that what are the risk factors for any condition, in fact, just first write smoking before you start thinking of everything, because smoking can cause anything that you think about. So smoking is a no-no. Smoking is a no-no. The same thing with alcohol. Pastor himself have talked here about the fact that sometimes he goes to events for some people, and by the time he's there, by the time pastor is there is no alcohol. But when pastor is stepping out, the alcohol comes out. So alcohol is a no-no as well. So next slide will show us the kind of things that use of tobacco can cause, from emphysema to pneumonia to stroke, peptic ulcer, name it, whatever it is, tobacco can cause it. Alcohol also can cause, next slide, liver cirrhosis, psychosis, withdrawal symptoms, cardiomyopathies are things that, use of alcohol can cause. The next slide talks about social connectedness, also very important. As much as a lot of people don't want to feel, maybe you just feel that I'm always on my own, I'm an introvert. It is important to always find yourself within a social circle, because you don't know when you would meet people. In Yoruba, they say, yes, very important. In my practice, we've seen conditions whereby people will come, maybe they have cancer, you've tried everything possible. It is when you invite their friends, church groups, professional groups come and help them. That's when they start getting better. Of course, when your mind is better, you start getting better. So social connectivity is very, very important. We should always find ourselves within a social circle, because it will also help to improve our health. So key lifestyle factors for good health. Next slide, please. Next slide. Yes. So the key things. We talked about 3 levels of, defense system. We talked about the personal hygiene, healthy practices, and of course, we'll talk about medical checkups. So among the healthy factors that we just mentioned, the key things that we must take away: diet, what we eat, very, very important. What we eat, very, very. Then exercise also. It said that diet and exercise drive 65% of your baseline health outcomes, creating a massive locus of personal control. So diet and exercise, very, very important. What we eat and how we expend energy. Then sleep as well too, very important. And like I said also, smoking should be avoided at all costs. Thank you. At this point, I'll call Dr. Theophilus to come and continue with the presentation.
Sorry, just in 30 seconds before Dr. Theophilus takes the presentation, can we come together, please? Those of us who are sitting at that back, can we come together? We'll take pictures so that we are one house. Preferably in the middle row, the middle row. Thank you. Hello, ma. Please, can you come forward, please, as much as possible? Yes, there's a lot of space in the front. There's no need to sit at the back. Thank you. Let's be together like a family. Thank you as you comply. God bless you. Thank you. Over to you, sir.
Thank you. Thank you so much. Good morning, church. and praise the Lord. So this morning I'll start by appreciating the pastorate for the opportunity to do this yet again, for always giving us a platform to be able to reach out and contribute our own reasonable service. We're also grateful to the coordinators of the program, the anchor, for always following us up, and I'm sure they will have some rest after this program today. Thank you so much for everybody that found time to attend. Now, the concept of health is changing. We're talking about, as much as possible, prevent a thing before it occurs. That's why there's a popular saying that prevention is better than cure. At every point, prevention is always better than cure. And we have to also know that there's a concept of what we call the balanced man. So you can have a pastor who can see dead people and then pray, lay hands on them, and they rise. But if that pastor is not disciplined enough in how he lives his life, obesity will kill him, and he will die by the grace of God. When he dies, he is going to be buried. You will take sick people to his grave, and there's so much anointing there that some of them can rise, but he remains deeply dead. Because even in church, we have seen people who are preaching and they slumped and died. So death is inevitable. But again, you want to do as much as possible your own part. You want to play your own part as much as possible so that you can be on the right side of history. Now, my brother has talked about the protection. He has talked about strengthening. And then I will talk about monitoring. So, monitoring, sometimes you don't have, despite all the first two steps that he has mentioned, some things may still pass through. Some things can still occur. One of the common symptoms to all disease is no symptom. If you see most obituaries and posters, they will tell you he died after a brief illness. Sometimes somebody is just, I remember there was an autopsy we did in 2019 in National Hospital. A pastor did a devotion with his family, and then when he finishes, he has this habit of going back to do his own devotion again. So he went to the bed and he knelt down and was praying. 5 minutes, 20 minutes, 30 minutes. The wife came, Daddy, it's not done. 1 hour, 1 hour, 30 minutes. This prayer done are you trying to kill devil? So it came to him and then touched him, and he was already cold. Dead. Gone. Probably for about an hour already. But by the time they brought him, it was already too cold for us to even do anything. So even the righteous man will still pass through death. But what are the things that we can do outside of the things he has mentioned? The next slide. What are the routine medical checkup that we should have, or we should make a habit of, checking from time to time? So we see that some of them have been highlighted. Blood pressure check. There's something we like to say, know your numbers. You have to know your numbers. You see somebody and say, how old are you? Then you start with 1965, 67, 68, 69, 70. Even their age, they are calculating it. So even the Bible says we should apply our heart to wisdom by numbering the days of our life. So you have to know your numbers. There are some numbers you must know. You can know your phone number, but know what are your numbers for your blood pressure. Because a man can be 100/60, 100/60. That's normal, all true. But the day he becomes 120/70, it's still normal, but there's something wrong. Because you have moved from one level to another level. And there's a gap. Even though it's still normal, but what is it that is responsible for that rise within the normal limit? So, if you don't know your numbers, it's difficult. Cholesterol test. They are silent killers. Cholesterol is one of them. There's something we call arteriolosclerosis, plaque formation. I have somebody that we worked together, and he just stopped seeing. He called and said, for 2 days now, he's blurry vision, but today he noticed that he cannot even see at all again. So when we went to the hospital, we found out that he had high level of cholesterol. He didn't even know. So it's before they say what you don't know cannot kill you, is a lie. What you know and what you don't know can still kill somebody. So he became blind in that eye because there was deposition of cholesterol plaques in the retina and he couldn't see. So what was even more scary is that the other eye was high at risk. The right eye is virtually gone, the left one is at risk. So we need to know what our cholesterol values are. Eye examination. You know, I don't know how many of us have an optometrist or an ophthalmologist that will visit. The way you have a doctor, in fact, we don't even have doctors. How do we have people that will check eyes sometimes? You know, if you know you have a doctor, it's the way you should, you know, check your eye regularly, especially as adults. The times have changed. The things that we don't used to see before are now being seen. So in medicine now, everything is possible. Blood sugar test. The way you know your blood pressure, you need to know your blood sugar. Cancer screening. We'll talk about that. What are the tests we can do to prevent some types of cancer? You know, if you go in a family, somebody already has breast cancer, I'm sorry, it means that you are at increased risk of developing that breast cancer. You know, now we're talking here both professional medical science and we're still Christians in church. So medical science says that if you have a family member who has prostate cancer, you as the man, you have an increased risk of developing that prostate cancer. As a matter of fact, that person is a generation above you, say for instance your father, your own risk is 10 years younger than when he developed his own. Science have proven. If a father has prostate cancer at 70 years, you have a likelihood of developing prostate cancer at 60 years, 10 years younger. And that follows for most other malignancies, especially malignancies that are found to be familial. That means they run in family, they run in generation. So there are things that we don't have to fight or argue with. We can pray about them, we can faith them, but we can also do the work, because show me your works, show me your faith, and I'll show you my work. So we need to balance the two. Then dental checkup. Honestly, in my life, until maybe last year, I've never seen a dentist. Even me, I'm guilty of that. WHO says you should see your dentist at least 6 months. Every six months, you should see your dentist. So these things are easier said than done. But again, don't say because you get away with these things, you will not do them. Because if the Bible said Moses was, I think, 80 years, and his eyes were not dim. But now, 8 years are using glasses. So we have to ensure that we create a balance between these things. And then whatever we can prevent is better than whatever we need to cure. The routine maintenance checklist above is to ensure early detection, which improves the treatment option and possibility of even a cure. Next slide, please. Okay, so what are the things we should screen for? In the past, everybody is concentrating on adults. Now, we are concentrating on humans from age 0. Have their vaccination according to the MPI schedule. Now we have the expanded MPI because there are diseases that are preventable by vaccination. You know, there are things that we can do to prevent the occurrence of certain diseases. So let us subject our children. Let's not join the naysayers that are saying that vaccines is to discourage reproduction, you know, this problem and the challenges that we have for the purpose of for the uptake of vaccination in the north. So you see all the vaccines here that are listed. In fact, you see that from the age of 5, you can start checking for dental caries. My daughter has done at least 2 or 3 tooth extraction, and she started doing it from 7. How can a 7-year-old girl have dental caries? That's tooth decay. Decay teeth that you have to, you know, decay tooth that you have to, you know, you have to extract. Obesity. Childhood obesity is something of increasing concern now. Is in the past you think that no, you have to be rich. No. Now, the rich man overfeeds his children. Malnutrition is undernutrition, not enough food, and overnutrition, too much food. That is malnutrition. You are malnourished. They say you are odogu and you are well fed, but you are malnourished. Even as a child, and then there's visual impairment. Children can be born with blindness, auditory impairment, and then counseling on exclusive breastfeeding. So this is a checklist, complete checklist for children under the age of 10. Next slide, please. Now, for adolescents, remember, medicine group people according to their peculiarity because it's easier to relate with them in that way and manner. Here, there are still some vaccines that you can take from the age of 11. Now, note that some of these vaccines, this list is a global list. Some of the things may not apply to us. For instance, the flu shot, because of the weather, in most of these our humid, less humid countries, they take these flu shots. But the ones that concern us, human papilloma virus, Nigeria has the highest rate of cervical cancer in the world. Nigeria. Breast cancer is the most common cancer in women. However, the highest cancer in the north is cervical cancer. And the reason is very simple: early marriage or early exposure to sex. So there's a junction in the female private part that before it is fully developed, there's already expression of physical activity there. So that can lead to what we call metaplasia. And metaplasia is a fertile ground for cancer to develop. Therefore, human papilloma virus is found in almost 70 to 80% of cancers. But there's a vaccine for it. The only thing is that a person should be vaccinated before their age of first sex. Because after you have had the first sexual encounter, there's no need. So tetanus, diphtheria, pertussis, meningococcal conjugate vaccine. Now heat is upon us, and you see the public campaigns going to schools, meningitis, and all those things. Then Dr. Bolarinwa has talked about body mass index. Now depression. Dr. Mofe may touch on it. Hepatitis B, HIV, and all these things. So we can begin to check at this age, because depending on the climate that you practice your medicine, sometimes already people here have 1 or 2 kids. Some of them are already exposed to sex. Some of them have been raped. So that's why you see that even sexually transmitted infections are there. Next slide, please. For women, 18 years and above. So here, I want to believe that most of us are within this bracket. Now, these vaccines, we talked about the human papilloma virus, 26 years and younger, if you have not had sexual exposure before, you can still have the vaccine. God is wonderful. The man carries the HPV on his penis, but doesn't do him so much harm, but it does for the woman. So that's why it spreads a lot in the north, because one man is married to 4 wives and has maybe 3 side chicks. So he spread it uniformly to them, and then you see that they start coming in 5 to 10 years later because he has deposited the virus, and the virus promotes carcinogenesis in them. So that's why it is important. The importance checklist for women above 18, you should know your blood pressure. We said it. It is an aberration. It is wrong. You don't know your age. You don't know your normal pulse. Pulse is how many times does your heart beat in a minute. Normal heart should beat between 60 to 100 times. If it is too low, it's bradycardia. That is, maybe it's 40 times. If it's too high, it's tachycardia. That means the pulse is above 100. So you should know what your pulse is. You should know what your blood pressure is. You should know what your BMI is, body mass index. We do it in the church here. You can come to the sick bay if you don't know it. We have BMI charts. You will see whether you are red, green, or blue. As the color is, so is the answer. Then you now know what to do. Then breast cancer, mammogram. Mammogram is a machine that checks for lumps in the breast. We talk about these things as part of our checklist, but there are things we can do. There are 2 ways to check for problems in the breast. We have what we call the clinical breast examination, and we have the laboratory breast examination, or radiologic, like this mammogram we're talking about. So sometimes your attention to details is shown in your health. You see a patient who comes to you, say, he's hypertensive, 15 years. Okay, what drugs are you taking? Don't know. You put something in your mouth, you don't care to know what it is. What is the milligram? He cannot remember. How do you take it? He's not certain. So you see, you can't do better than how your disposition is. And you can't be very cautious about the word of God and unconscious about the other things around you. That is why the concept of the new generation is the balanced man. So that you can sing and everybody is falling under anointing, but you cannot control what you eat. You die of hypercholesterolemia, nothing will happen. The world will continue. And we have seen pastors who are blind. We have seen pastors who have, living with consequences of their actions or inactions. So anointed bones will still be buried, but they will raise other people up, but they will not be able to help themselves, because my people perish for lack of knowledge. So it's important for us to understand here that our breast is an organ that is at risk of carcinogenesis, of cancer. And black women, because of some factors, the genetic one, we talk about modifiable or non-modifiable, you can't change it. If you're a woman, you're at increased risk of breast cancer. Men have breast cancer too, but maybe 1 out of every 100, And then clinical breast examination. You should be able to look at your breast and say something is wrong. But you don't have a habit of looking at your breast and knowing that something is wrong. If your nipples are supposed to be like this, all right, and they are elevated, or they are supposed to be pointing downwards, and they are angulated, you already know that something may be wrong. But only because you have been observing to know that this is normal. So that the day you deviate from the normal, you're able to identify that, something may be wrong. Then you want to escalate it to have a clinician check. Because the doctor will not live in your house with you. He will not know your body better than you do. So it's important for us to be able to tell, my tummy is increasing. I'm creating a new birth hole. This cloth is tighter. This cloth is sagging. Already, before you get to the point of needing anybody, you are already observant enough. So, cervical cancer, I've talked about pap smear. For women who are above 18, that's what we call pap smear. That's the only screening test we have for cervical cancer. The cervix is just above the vagina, right? And there's a smear you can take, and you can check. In early cases, this is treatable, 100% curable. I know of a family member of mine a family friend of mine who was diagnosed with breast cancer, and she's been alive more than 15 years, cured of the breast cancer. So whatever you dictate early, you may be able to prevent. We talked about cholesterol. Maybe we don't need to repeat that. Colon cancer. So there's colonoscopy. You put a small camera into the anus. It's a discomforting procedure, but it's rewarding, because the day you find something, you can quickly act on it. Every president that comes into the United States of America, this is medical, and they publish it. Now, in the last 15 years, 2 American presidents had early signs of colon cancer, and they were taken care of. You remember Angelina Jolie? Her mother had breast cancer, So she just, if my mother had breast cancer, like we said, whatever your father suffered, you have an increased risk of suffering that thing, but at an earlier age. So she went and checked. They didn't find anything, but she still allowed knowledge prevail, and she said, take out the breast. So they don't take it out at the same time. They took out the first one, right, and sent it to the lab, nothing, negative for breast cancer. And the second stage surgery was done. The second one had early breast cancer. So will you rather we have Angelina Jolie with her breast and she dies, or she's alive and she's no breast? So depression, hepatitis B, hepatitis C, HIV, intimate partner violence, and osteoporosis. So we talk about osteoporosis, especially for our senior citizens, 65 years and above. Sometimes, 65 years and above, maybe foreign, but here we have arthritis now, 40 years, arthritis, 30 years, So, and the problem is this: you are loading more weight. You are not increasing the size, the mineralization of the bone. And when a woman's menstruation ceases and she's in menopause, there are some hormones that are withdrawn. Those hormones are part of the hormones that helps her balance our calcium metabolism. Therefore, when the menopause comes in, those are some of the things that begins to show, small joints and big joints. Next slide, please. So this is the screening test for men. We'll just go to the ones that are important. Pressure, blood sugar, we've talked about all of this. The ones that are peculiar to men, lung cancer is more common in men. So especially if some of the risks that my colleague mentioned earlier, you smoke, you should know that you have to do that. Next slide. So because this is very important, we created a different slide for this, prostate cancer. We already mentioned it. If you have a first-degree relative that developed prostate cancer at 70, you have the medical probability of developing prostate cancer 10 years before that person. So you have to be on the lookout, you have to be on the watch out. Say if your eye is going to take it to why not pluck it out? You can remove your prostate. You can do prostatectomy. Because if you already have children, you don't have any, whatever sexual need you need, because you can actually still perform without your prostate gland. So you can take the prostate gland out. That's your safety net. And wisdom is profitable to direct. So called PSA, prostate-specific antigen. Every man, black man, is advised to know his PSA or start doing his PSA by 45. But I want you to know that we have people who have prostate cancer before 45. So you should do routine medical check at least once in a year. And the result of that medical check, we suggest to you, or your physician will let you know how often you should do it going forward. Because you may find something there, that is suspicious. So they may tell you repeat 1 or 2 of those tests in 3 months, or come in 6 months, or just continue to do it every year. So it's very important that every man knows their PSA by the time they are 45. It's not just the PSA. You can see a urologist who does a digital rectal exam. They can examine the prostate too, to know how it's going. A man should know the shape of his private parts, whether it is the testicles or the phallus itself. Because, sometimes when people want to get married, even if they've never had sex, that's when they know that they may have a problem of infertility. So I was involved in a young man's story who came. He married very early, but he doesn't have any child. They've been having difficulty. He didn't even bother. He didn't think he had any problem in his life. So every time it's the woman that goes to the hospital. That's another wrong thing. She goes, does all the checks, she ovulates, she doesn't have any problem. It's the man. He has never shown up. So the day he showed up and we examined him, do you know that it's so embarrassing that somebody is 32 years and he never knew all his life that had only one testis? Only one testis. And then we just, okay, go and do a simple scan. We found out he had a second testis in his stomach. So he had 2 testicles. Again, the problem started from his father or his mother, who never, or maybe even the hospital where he was born. But you know that, in fairness to them, a child can be born with undistended testes. The distension of the testes from the tummy, or tummy area, actually is completed in the early days of life. So you can have 2 empty scrotal sacs. But as an adult, you grow up, you never knew that you have only 1 testicle, so you never touch your private area. I just feel those kind of people have laissez-faire that cannot be explained. Because you can't be so interested in making money, you are so rich, but you will die young, or you will suffer a discontinuation of your generation or lineage because you cannot pay attention to some of these things. So now we must begin to take responsibility for our health. And it cannot just be that somebody is failing because they are not studying in school. We have to be a balanced human. Now, we should consider doing PSA annually, those with a family of prostate cancer. And then lower the screening age. Because if you, like we said, sometimes this is for the general population, but sometimes you may have a reason to do this test more frequently. Next. So now there is a comparison of the proactive and the reactive health metrics. Now you want to look at it. If you are proactive or you are reactive, somebody who is proactive is, I know I'm getting old, though. Let me begin to sleep according to the sleep chart that was displayed. I know I'm getting old, though. Let me begin to eat the way I should eat. Maybe I've gotten away with donuts, burgers, 10 roundabout, 5 shaki, 7 pomo, in the past. Can I now begin to eat accordingly, according to my age? So you are proactive. Can I begin to exercise? We have talked about it before. We have seen it. It's always in the news. Pastors preaching, doing miracle, and they will slump and die. So I don't think God will do for us what we should do for ourselves. So he lives in the heaven, and he said he has given us. The first thing he gave in Genesis was dominion. So the dominion includes ourselves, our appetites, our lifestyle. Now, a man who is proactive will not wait until something happens. A man who is reactive, when he is feeling headache, that's when he takes an action. Some people will still say, no, this headache, I beg. I know it's because I didn't sleep well. They may still not sleep. Correct it. So you just want to keep going, but you are not paying attention to the details. The main reason we talked about hygiene here is to prevent the entry of disease into our body. Our skin, our hands, our nails, all these things are barriers. To do that frequently. That's why I talk about bathing, trimming your nails, eating right. You want to, and you know that this for your own hygiene, you have a high level of control over it. That is why it is saying locus of control is high, because it's personal. It's your. That's why you say, I met this man who is a very neat man. I met this woman, she's a very neat woman. Her fingers are well trimmed, her nails are well trimmed, she's well shaven, she's, all those kind of things. Hairs are well breathed, but not the one that you take out your wig or you say hello and you quickly, sneeze to the side because of the smell. Now, we talk about strengthening our lifestyle. The primary goal here is to build internal resilience. From here, we're talking about the external factors. As God created us, he created bacteria and viruses. So they will come. They're only trying to survive and ensure they have grandchildren. The joy of a dying father is the presence of a worthy successor. So Lassa fever does not want to end. They don't want to go extinct. And multi-mammoth rats are there. They will drive in your house, they will come to your kitchen, and they will urinate on your food. If you don't cook them well, problem. Now, if we want to build internal resilience, we have to develop our lifestyle. And the frequency of doing this is to do that daily and as much as possible weekly. We saw the chart. 5 days in 7 days. 5 days, deliberate exercise, 30 minutes a day can improve our health. And not more than 2 days rest in between. Evidence-based. Now, this also has a high locus of control because you can put in your effort to do that. Then for the medical monitoring, here, there are some things that no matter what you do with personal hygiene and lifestyle, because diseases are classified into two. We have communicable and non-communicable diseases. For the communicable diseases, those are the ones somebody sneezes on you, you catch tuberculosis. So non-communicable disease doesn't matter whether you live in a slum. If you want to be hypertensive, you can develop hypertension. So for these ones, there are factors that may not be as a result of one or two, or maybe they escape one or two defense. So you need to detect silent systemic issues, because sometimes he died after a brief illness because some things have been incubating. And many of our diseases don't just start and go all the way to expression. It takes time to build up. So the least we can do, the frequency of checking our health should be at least once a year or biannually. There should be a third condition there, or as may be required. A person who has HIV and is on antiretroviral drug cannot do medical check once a year, because there are some things you need to be checking. Is the drug working for you? Are you developing tuberculosis? Any opportunistic cancer? These are the things that we need to know. Then, control is difficult here as individuals, because you are going to subject yourself to your doctor, laboratories, to anybody who is doing the check for you. Next slide. Now, this is a preventive health flywheel. It's just trying to show us that if we have excellent personal and environmental hygiene, it can prevent acute debilitating diseases. People have died from diarrhea. If you see State of the World Children, they release this data every year, you will see how many people die from tropical Africa, especially under 5 deaths from diarrhea disease. Diarrhea disease. So if you come here, you want to allow for consistent physical activity and optimal nutrition. Then you do the medical checks, which will yield superior results during routine medical screening and provide personalized data to further define our daily habits. So this is a continuous loop, and you see success of one pillar will lead to the capability of the next. Next. So now, what we have tried to project, or the message we are trying to put out, is that personal hygiene is the foundation of health. As an undergraduate, my study was on hand wash, and it was approved by my supervisor. Basic hand wash hygiene. And when we served the questionnaire, I can't remember the data exactly, but it was so bad. If you get to your house sometimes after a long day, most of us have toilet wares that are white, and you wash your hand with soap, you see what comes out. You can't believe it. But then you're comfortable to just pick something and you shake everybody. Have you seen some people when you're not looking at them? The thing that they are scratching with their fingers, God have mercy. When you're not looking at them, they don't know you're looking at them. So it's very important. Then healthy living promotes longevity. Those lifestyles were talked about. Then after that, you want to do your regular checkup. You know, I was listening to a message. I can't remember whether it was at the GO or Bishop Oyedepo. And he said, look, people should not be deceived though. For 15 years, okay, it was Bishop Oyedepo. 15 years, he has not eaten rice. 20 years, he has not eaten bread. And he did not die. And he's healthy. And he said he has not taken medication for more than 30 years. So people pay the price. It's the same way people work so hard, and you cannot envy their success if you're not part of their story. It's the same thing with health. We must see our health as our investment, and the reward is personal. You are the one that and any other thing we stem out from that healthy state that we're free. I think the last slide. So, in conclusion, WHO define health as a complete state of total well-being. Physical, that's how you feel. Mental and social well-being. Now, even the Bible says in the book of John, 3 John 1:2, that beloved, I pray that you may prosper in all things, and you live in health, even as your soul prospereth. So God is interested in our health. Everything else is important to us until our health is challenged. However, we pray that God continue to keep us in good health. I live with the quote of Jim Rohn, who said that take care of your body is the only place you have to live. Thank you so much.